Today I want to take you through what a typical new patient visit looks like here at New Hope. And also I wanted to just share with you some of the typical protocols that we use for treating Lyme disease. So first, a brand new patient here at New Hope will get an intake paperwork just like you would with any other clinic. Our paperwork is a little bit longer than most other typical clinics. There's a lot of things we want to know about. There's a lot of potential clues in a history that will help us to kind of figure out what's going on. So after getting that paperwork to us, I definitely take some time to go through that before I see each patient so that I have at least a little bit of knowledge of what's going on. And then through the new patient process, I would say that on average, most new patients will spend about 2 hours here at the center. And about an hour to an hour and a half of that is generally spent with me going over everything. And here, unique to our center is that we also have a life coach and health coach that you will meet with who has gone through the treatment for Lyme disease, and she knows a lot about what it takes from a patient perspective. So that's one of the greatest things that we have here is that we not only have the knowledge to treat Lyme, but we have people here that have been treated, so we can help you through that process. And then thirdly, for each new patient, we have a slot that is set aside for meeting with our mental health counselor. Because there's so many things that go on in regard to our mental health with Lyme that it's important for us to address that. After doing a thorough history and examination, the next step goes into, do we do testing or do we not? And it kind of depends on each patient. Some patients will come to us having already done all kinds of testing and have already found out that they have Lyme disease and co-infections, among other things. And so sometimes we're able to kind of just pick right up where they left off at other places. For a brand new patient who's never been tested for Lyme or has never had a positive test, we usually do start with testing, and I've got some videos that talk a little bit about the labs we use, and I'll link them here to give you some more info as far as how that goes. So generally, at the end of the visit, we will do a lab draw, and then we'll send that lab out. And most specialty labs take about 2 weeks to get their test results. From there, then we set up a phone call to go over test results or visit in person, depending on each patient and where they're at. And then we go over results and treatment plan. So let's talk about protocol. I know that was kind of a really quick overview of what a new patient visit looks like. And I don't want to bore you with too many details there. I really wanted to get into what is the protocol and what do we do. So let's say I'm just going to take an average patient. So an average patient with Lyme disease generally will have Lyme along with co-infections. And they can also have chronic inflammation and autoimmune disorders. They can have things like environmental issues with mold or other factors that may be playing into their health that we do have to take account for in their Lyme treatment. But we can't do it all at once. And if we did too much at the same time, we would overwhelm anybody. Just mentally, it's tough to wrap your head around all that treatment. But also physically, we want the body to have time to respond, and then we build upon each treatment. I call it what I call a layered approach to treatment. So we start with what we think is probably the main issue, start some treatments there, and then we move on with that as we feel like things are improving and we need to add more additional treatments. So let's just start with a patient whose main issue is Lyme disease, and that's what we're treating. So today I'm going to go over the antibiotic approach and the medication approach to this. In other videos, I'm going to go over some protocols with more herbal and holistic, other treatments, other off-label medications. What are some of those protocols? But just for today's video, we're going to talk about the antibiotic approach. Antibiotics are still used in a lot of chronic Lyme patients because they do work. I know there's a lot of mixed opinions about that out there, but from my perspective as a clinician, they do work. They're not without risks, and they're not for everybody, and they don't work great for every single patient. That's why there are other options out there, but again, it's a good starting place for most patients. We're talking about the average person here. So initially what I will do is I will start most patients on a dual therapy regimen for Lyme disease. And what I try to do is make sure that I give them something that's going to cover whatever might be there. So for instance, if we got a patient with Lyme, Babesia, and Bartonella, again, a very common trio of things that we see, I might use a combination of something like azithromycin with rifampin, which treats Lyme disease. Azithromycin also can treat Babesia, and that's also a really good coverage for Bartonella. So we might start with something like that. If we're dealing more with, Lyme again being the main player, another common regimen that I'll start with is something like minocycline, which is very similar to doxycycline, but it does seem to cross the blood-brain barrier a little bit better from what we've studied. And the other one that I'll pair that with is typically something like ceftonir, which is a cephalosporin. These two antibiotics are very complementary. They work very differently, and so that's one of the reasons I really like using them. Minocycline is what we refer to as an intracellular antibiotic. It penetrates the cells and it works by breaking up some of the processes within the cell, keeping the cell from being able to replicate and survive. Whereas ceftonir is what we call a cell wall antibiotic. It works, and it's extracellular. It works outside the cell. It works by breaking down the wall of that bacteria, which then will cause cell lysis, which is basically the cell kind of exploding, and it can't survive because it doesn't have a good cell wall to keep it functioning and safe. So doing a combination like that allows us to kind of tackle Lyme from a couple different angles and make sure we're penetrating different areas that Lyme may be in, as we know that it can penetrate many parts of the body. And minocycline and ceftonir, though not as good as azithromycin and rifampin, still can provide some coverage for those other co-infections as well. So I'll start with something like that. We'll get on a really good probiotic along with that. And, we may address some other issues initially too, talking about nutrition and health and diet and those kind of things as well. Again, really patient dependent, because sometimes that's all we can handle. There's been plenty of studies out there that have shown that when you go from taking a medication or a supplement once a day to twice a day, the compliance level goes way down. And then when you go from 3 times a day or 2 times a day to 3 times a day, it takes another drop down. And so any new patient with a dual therapy regimen and probiotics are going to be taking something 3 times a day. So we want to make sure that what we are giving to the patient is doable and going to be beneficial. In about 4 to 6 weeks after that first initial visit, after that start of the treatment plan, I'll follow up with the patient and we'll discuss how things are going. Of course, we typically do a phone call a couple weeks after the initial visit as well, which then just kind of gives us a sense of where things are at, how we're tolerating treatment. Sometimes we have to make changes sooner, make sure that we're dealing with any Herxheimer reactions that may occur. And then at that follow-up visit, I like to see if we're seeing any signs whatsoever that we're headed in the right direction with this treatment. And that could be something as simple as a Herxheimer response. If someone is actually noticing that is a sign that the bacteria are dying and that the antibiotics are doing something for them. So that alone is helpful. There are, I would say, a lot of patients who do feel some improvements even in that first 4 to 6 weeks. And that's another sign to us that we're headed in the right direction. For the patients that we see that don't seem to have a great response in that first 4 to 6 weeks, we may consider either staying the course, giving it a little more time, because there can definitely be patients who take longer to see the response. We may add additional treatments, making sure that we're covering for things that we feel like we need better coverage for. Or we may change everything altogether. It again, really depends. So from there then, it's basically a series of follow-ups, and I like to follow up with patients every 4 to 6 weeks when we're dealing with medications. We'll get maintenance lab work every 2 to 3 months on average, depending on the medication as well, looking at making sure that the kidney and liver function is doing well, that the blood count and everything is looking good there as well. So the next things I think about, so we want to make sure that we're covering all of our infections, right? So that's kind of my first step, is we want to layer the treatment in so that we have something that's covering everything, and that we're tolerating it well, and that it feels like it's making some difference. We continue that as long as we feel like things are going well. Along the way, we will add treatments to address things like biofilms. Biofilms are a really common thing that we see with many different types of infections, and Lyme is no different, and in fact is thought to be one of the reasons why Lyme can be so persistent and sometimes hard to kill. So we'll add different things to address biofilms. An antibiotic regimen that covers multiple things in and of itself can be helpful for biofilms, but there are also different enzymes and other supplements and things that have been shown to be helpful to break down biofilms, and I like to add at least a couple of those things. My experience has been that just one biofilm treatment or biofilm buster, whatever you want to call it, just that alone is not always enough. I feel like there needs to be a couple, so I'd like to add at least two. There may be even more sometimes, just depends. And then other things I think about is how are we going to help reduce inflammation in the body? One of the things that I like to use a lot is low-dose naltrexone. I've got another video about that, but there are other things that can help in inflammation here as well. Many other different therapies, and again, looking back at things like diet and lifestyle and all of that can be another thing that kind of comes into play here as we continue to add these layers to the treatment plan. And as I mentioned earlier, some of those environmental issues like mold and other factors are things that we think about as well. So as we're going, I'm always thinking in my mind, what are we going to need to do next? And do we need to be adding anything now, or can we stay the course? Do we need to be changing anything up? So it's really kind of a back and forth between myself and the patient as to what is the best thing for that particular patient. And a lot of times with antibiotic treatment, we will also add herbal treatments into the mix as well. So I know there's a lot of things that I left out, and I know there's a lot more things that you probably have questions about. What about this and what about that? But for the sake of this video, again, I just kind of want to give you a basic overall, an overview of what would be expected and kind of what to be thinking about. So let's fast forward here. So in an ideal situation, we find the right regimen, we treat the infections, we treat the inflammation, we get the immune system working better, we take care of those environmental and lifestyle issues, and we get to a point where things are doing well. Now, on average, a patient that treats for chronic Lyme and co-infections is going to take a good year or more. There are some patients, I've had some patients within 6-7 months that are doing great, and that's fantastic, and I love those cases. I've also had cases that are a couple years in and are still struggling with some symptoms. So there's a range for sure, but something to be expected is that it's not going to be a quick fix. You've been dealing with this for a long time. These bacteria have ways of persisting. They have effects that can cause chronic symptoms, and we need to address those things. But let's say we get to that point. When we're at that point, then what? So initially, what I like to do is if we're still on any stronger medications like the antibiotics, I like to transition off of those. And so my general plan is to go from the antibiotics or medications over to an herbal approach. Now, I don't consider an herbal approach a lesser approach, but it is, in my opinion, less potent in most cases. So, and the other thing about herbal treatments is that they have less side effects and less issues. And so I really like to make that transition because then we're not simply just cutting off care and seeing what happens. We are kind of taking a step down approach to the care and getting ourselves off of some of these other medications. I've definitely found cases where people have some symptoms that just want to linger, and then once we stop the medication, some of those symptoms actually get better just because they may be an adverse effect from the medication itself. So we'll transition, and we'll do it usually one at a time, where we take away an antibiotic, add an herbal, do the same thing with the other ones until we're at the point where we're just simply trying to maintain and continue forward. Once someone has been stable on an herbal step-down regimen for 3 to 6 months in that range, that's when we start thinking about taking that away as well. And again, my whole approach and my idea is that I'd like to make sure that we're doing well and that we're stable before we take those treatments away, and that we remain stable off of those treatments. And the hope is to get you off to get you feeling better, and to get you not having to rely on these things. In the real world, that's not always the case. There are some patients who need to chronically treat inflammation for quite some time, or need to do things to address their immune system, or need to stay on a very clean, healthy diet for quite some time to keep symptoms at bay. But it's really, in those cases, we're still seeing drastic improvement. And yeah, there may be some things that need to be done to continue those improvements, but compared to how you feel before you start treatment, those things are a small price to pay for your health and for your well-being, and to live a long, healthy life where you're feeling good and don't always have to be wondering if Lyme is going to come back. There are some patients that have relapses. There are cases that seem to go into remission, so to speak, that then will relapse down the road. And yes, sometimes we need to retreat those cases. But by and large, our goal here is to get you better and keep you better. So I hope this was helpful for some of you that maybe are going through this, or looking to go through this for your first time, or aren't really sure what to expect, or just want to know, hey, what's going to happen when I come see you guys, or I go see another Lyme clinic. This is, again, a very typical kind of average case, but every single case is going to be different as far as the starting protocol and where we go with it from there. So it was good talking with you today, and I hope this is helpful again. And if there's any questions, please leave them in the comments. I'd be happy to answer those, and best of luck to you. And if there's anybody you can share this with, please do. I know that there's lots of people out there suffering with Lyme that need additional help and knowledge. So your support to them goes a long way.